The COVID National Public Health Emergency has officially been renewed by the U.S. Department of Health and Human Services Secretary Becerra. This is now the 12th time that the public health emergency for COVID has been renewed since its initial declaration back in January of 2020. The renewal is for an additional 90 days, which means it takes us to the middle of April 2023. The renewal was expected. The feds had promised 60 days advance notice if the public health emergency were to come to an end, and we did not get 60 days notice. So we knew that when we came to the middle of January, it was indeed going to be renewed into April of 2023. And the public health emergency status means that many changes because of COVID continue. Some program changes, some regulatory changes, and some funding changes. But for the first time, there are some additional changes that are no longer tied to the public health emergency. Because of congressional action at the end of December 2022, continuous Medicaid eligibility and emergency allotments in food programs and SNAP benefits have a new end date. They are no longer tied to the national public health emergency. So even though the COVID public health emergency may continue on into the future, emergency allotments in food share will end after the February issuance month, and continuous eligibility and Medicaid will start coming to an end at the start of April. States will have 12 months to initiate an unwinding process from continuous Medicaid eligibility. We have separate videos on both of those topics. Right now, we know that the COVID public health emergency will continue into April. We'll then watch in the middle of February to see if we get the 60 days notice that it will be coming to an end in the middle of April. You can watch back here for updates. We link to resources from the feds in the description below.